Warning, this is not a podcast for those who have got it together. We are men seeking answers to the questions that have plagued our mind. Can we be undefeated?
Hey, thank you guys for listening to my podcast. I'm here with Julie. Hey, Julie.
Hi, how are you?
I'm good. So thank you so much for taking the time to come talk to you. I really have been wanting to talk to you for a while. And it's just because, I think that the work you do is very interesting. I'm, of course, very interested in anything to do with healthcare, but especially the elderly. And you have a tendency to work a lot with the elderly. So you're in hospice.
Yes.
Can you tell us a little bit about that journey and just kind of what you're doing with hospice? That way, people listening can kind of get to know you and your career with hospice.
Well, I guess I have to start from the beginning. I didn't start out wanting to work in hospice. I am a social worker. I am licensed. And I think originally when I first became a social worker, I had originally wanted to work with people. In general, I didn't have anything set out or in mind as to what I wanted to do. But my first experience in healthcare was during grad school. My practicum was set at St. Anthony's in their inpatient rehab unit. So that was my first little view into the healthcare system. And then after I graduated, I ended up working at Mercy Health Center in Oklahoma City for 3 years, working in the NICU, labor and delivery. But I also did ER, oncology, ICU. So I had a really good, well-rounded experience in hospitals and healthcare. And as a social worker in a hospital setting, you do a lot of discharge planning. So when people are leaving the hospital, you set up everything that they're going to need when they go home to be successful. So that was probably my first experience with hospice, would be setting up and arranging hospice services for patients leaving the hospital. Then ended up moving to Elk City in 2009. Worked at the Sayre Hospital for a little bit in geriatrics. I worked in the outpatient unit at Stonebrook doing outpatient counseling. So worked with the older population there. And then started working in the hospice area. I worked for Faith Hospice years and years ago as a social worker, and then worked for the hospital here in Elk City for 5 years as a discharge planner. So I've always done home health, hospice, setting up wound vacs, any type of services. And then back in 2014, Carrie Perry called me asking to do social work supervisory role. So I've been doing that. And then I've been with the company for 3 years full time.
Wow.
So yeah.
That's a pretty big.
So 18 years later, I'm still doing hospice,
Yeah.
still doing medical work.
So if you had to describe, here's how I would describe a social worker, not necessarily in the hospice setting, but just overall in healthcare, I'll say. Mm-hmm. Especially, I come from, of course, the more long-term care nursing home. I've done that for 24 years, but here's how I describe it. Mm-hmm. I describe a social worker as an advocate between the resident patient and the facilities, basically, or the company.
Yes.
That's how I would describe
Patient
it.
advocate. Yes.
And
first and foremost.
And, whenever I would introduce in a meeting or whatever our social worker, that's how I'd always kind of explain it, because I thought in a layman's term, it was a good way to do it. But also, it seems to me like a social worker is looking at definitely discharge planning. That's a big deal. But also whenever they're admitting, that's a big part of it. And then I also think about even end of life decisions like DNRs,
yes,
do not resuscitate orders, yes, looking at power of attorneys are kind of a big part of that. Would you agree with that, or am I maybe off a little bit in how I would describe it?
No, it's very correct. And every time, no matter what setting I've worked in, because I've worked in private and for-profit settings, and basically every interaction starts with a psychosocial assessment. You want to meet the patient, the person, the client, whatever term you want to call them. You want to meet them where they are. So you are always getting to ask questions, be a little nosy, and figuring out who are you, where do you come from, what's going on with you right now, and how can I help make the situation better? How can I assist you? How can I assist your family? How can I answer questions or get you the right information and resources to make this journey a little bit easier of a process? So whether it's in a nursing home setting, whether it's at home, whether it's a hospital, you're always trying to figure out what's going on right now and how can I help you?
Yeah. Yeah. I think that, to me, I think it's like, honestly, so when I started in long-term care, probably one of the first like professional friendships that I made and like connected with was that social worker at the time. And I mean, really that person had a big impact. And I think that at times, especially you're talking about like 20 something years ago, the social worker was not considered like a really important part of the, like what they call like interdisciplinary team. But I think over time that's really developed and changed where, hey, that is an important part of the team. You know, I think of even the social workers looking at, even though you don't have like the medical nursing, you know, like you're not a nurse, but on the same point, helping to look at, medications like psycho, you know, those kind of medications like this, the meds, and looking at the, interactions with other medications. And so believe it or not, like I saw a lot of that where they're having to kind of be an advocate for the patient that maybe they're using two drugs that really hurt each other, and the side effects, you know, were contrary, you know, it wasn't good for them.
Right. So. Well, no, I agree. I think, as a social worker, being a part of an interdisciplinary team, it is very important. So, at Caring Hands Hospice, we have interdisciplinary team meetings every 2 weeks on all of our patients. So it's your nurses, your social workers, your chaplains, your medical director, all talking about what's going on. If there are any medication changes, if there's any concerns about pain or mental health situations.
Pain is a big one. Yeah.
Pain's a big deal.
Mm-hmm.
And then, yes, it's looking at the whole picture. And that's what's nice is being able to discuss every aspect of what's going on and getting everyone's point of view to figure out a solution.
What, first of all, where are you from originally? Because you do have a different accent.
Do I?
I think you do.
Oh, I was born in Hays, Kansas.
Oh, well, that's not too bad. No. And I don't mean like a bad accent. No, I can hear a little bit of an accent. So
when I get, I don't know, I think when I get tired, that Okie accent comes out, but I don't know. I thank you, I guess. I'm from Kansas originally, born in Hays. A lot of our family is from north central Kansas up in the Beloit area. Moved to Springfield, Missouri when I was 3, moved to Elk City when I was 6. So
you lived here a long time.
I lived here a long time. Yeah. So January of 1989 is when we moved here.
Good. I like it. So back to, you know, maybe some people listening may not completely understand what hospice does.
Okay.
They may have misconceptions about what hospice does. Can you, from your point of view, explain what hospice does and also part of the benefits of hospice and just in that aspect?
I think when you say hospice, it's a really scary word to a lot of people. So hospice usually doesn't get involved until end of life. So it could be for a person in their 30s, it could be someone in their 60s, someone in their 90s. It doesn't really matter. It just, at the end of, in order to be on a hospice service, you have to have an end-stage diagnosis. So you have to have some type of medical situation that you are not going to be able to recover from. So sometimes that's lung disease, heart disease, liver disease. It could be a form of cancer. It could be anything. So, you know, a lot of times when you first get the news that this is the new situation that we're working with, people try to seek help, which is wonderful. So you go to the doctor's appointments, you get on the right medications, you treat the symptoms, you do everything that you can. And in a lot of situations, people improve, which is wonderful. And then sometimes your situation isn't going to improve. So what do we do then? A lot of times, your primary care physician, whoever that is, you'll have a conversation with them, based on, the situation. And, they might say, there's really nothing that we can do to improve your life expectancy. I'm not really sure how to say that, I guess. But let's just try to keep you comfortable. So it's a very difficult conversation to have on, this is the last phase of this life. This is the final journey that you're going to be walking. And so, a lot of people, when they leave the hospital and they're recovering and things are getting better, you might use a home health service. So home health, brings in nurses, brings in therapies. They help with your medication management to try to improve your health and to make you better. Hospice is involved when we're just trying to help make you comfortable, make you help with your pain management, help with symptom control, but helping you walk that final journey of this life.
So if somebody is, maybe it's a parent of theirs, mom or dad, or maybe it's, husband or spouse that maybe have gotten, a diagnosis, or they've gotten a bad report that, hey, things are, you have something terminal. So what would you tell them about what's the reason behind maybe getting you guys involved in that situation? Because maybe you mentioned it's like somebody 30 years old. It's like, do I need to get hospice involved, or what's some good reasons behind that?
So, for someone who is older that has Medicare, hospice is a Medicare benefit. So it's a service that is provided through the Medicare system anyway. A lot of times, with hospice, whether you're needing equipment, any type of equipment, say a hospital bed, oxygen, bedside table, bedside commode, any walkers, anything that's going to help make you comfortable in that aspect, it's provided through the hospice benefit. One thing that I think is interesting is with hospice, you get more nursing visits than you do home health. So we try to see everybody at least 5 days a week. So we have an aide that comes in 3 times a week that helps with bathing care and getting you dressed. We do wound care. We have a nurse that will come in and assess your medication regimen. If it's not something that's needed to keep you comfortable, then we will have those discussions on maybe these are some medications that you don't want to take anymore. There are certain people who, at a certain point, have a hard time eating and drinking. So then we, in our interdisciplinary team, we kind of discuss what's needed, what can we do to make this person feel more comfortable and at ease. And I think what's really good about hospice too is that it's not just for the patient that's needing the medication, that's needing the equipment. We're there to help the family, because there's a lot of times there's conversations that have never been had in a person's lifetime that need to happen before they pass on. So, that's when the social worker and the chaplain get involved, because we're not just there to hold the patient's hand. We're there to hold the family's hand and say goodbye. There's a lot of times that we say that I think there's 4 things that need to be said before someone passes, and it's thank you, I'm sorry, I forgive you, and that we're going to be okay. A lot of times people just want permission, and they just need to hear that it's going to be hard. We're going to grieve. This is going to be a really sad situation that we're going to have to deal with, but we're going to be okay. And once they have that permission, sometimes it makes, we call it a good death. We want them to have a good death experience. We don't want them to hurt. We don't want them to have any more anxiety or fear than they need to. So if we can hold their hands, walk them through that process, that's what we want to do. We want to be able to help everybody in our community the best that we can.
Yeah. There's something that I'm aware of, and that I don't know that a lot of people are aware of, that hospice provides, is like after passing care to the family. You mentioned the families, that it's a benefit to them as well.
Yes.
But you guys provide services for like grieving after the passing of their loved one. Can you just kind of talk about that a little bit and like what that looks like?
Right. Well, I'm actually the bereavement coordinator for, I wear a lot of hats, but so I'm also the bereavement coordinator for Comforting Hands Hospice. And what it looks like is it's not a mandatory program. So, but what we do is we walk with you through that first 13 months after death. So when that person passes away, we keep in contact with you for 13 months. We don't harass you. We let you and your family grieve, however that looks to you, whatever appropriate way that looks. But we provide just another hand to hold. We provide education and resources and services. So usually that looks like mailings. I will mail you information. I will send you, as a social worker, I do a lot of education. Some hospice companies might have a chaplain that is responsible for the bereavement program. So it might be a more spiritual based approach. And then since I'm a social worker, mine's more of an education approach, I guess. So I send out information. I make phone calls. I'll go and do visits as needed. I try to get you in contact with counselors or support groups as needed. And then every year we provide a community memorial service. Up until 2020, most hospice companies will provide a memorial for just their patients only, which is not a bad thing. I think it's a wonderful thing. But because of COVID and everything that was happening, we have actually found that the bereavement program through CMS for hospice companies in general is considered a community program. So I've tried to run with that and provide a memorial to the entire community. So this last year, we joined forces with the Elk City Chamber of Commerce with Susie Cupp. And we had it at the museum at the Opera House. And we invited everybody. So whether you lost someone on hospice service or you just lost someone to anything, we invited everyone to come out and, listen to a speaker and be able to have just a moment to remember your loved ones. And we were able to have a 7-foot tall metal Christmas tree built by the welding students at the Votech in Burns Flat. And we had it placed out at Ackley Park where people could come and remember their loved ones and put their names on the tree. And our plan is to do that every year. So the education, the letters, the extra support, and then the memorial service that we do annually is what our bereavement program looks like.
Yeah, that's great. So another thing I wanted to kind of ask you about is, and it's actually something I've modeled in nursing homes and assisted livings and other areas. I've modeled that same program, which a portion of the labor hours, and again, you can correct me if I'm not saying exactly right, but portion of the labor hours for you guys has to be volunteer. And really, I thought, I was a part of a hospice, like as their director a long time ago, really whenever hospices really started being a thing. And, I was pretty impressed by the volunteer program and how they, outlined that. And I thought it was a great tool that other healthcare places could use because, the part of it is like getting the community involved, getting them, we both know this is like, there's not enough hours in the day to do every single thing you need to do. And so part of that volunteer program, it it gives back to it helps people give back to the community. I can't tell you how many times I've had people say that they would love to volunteer, but they weren't sure how to volunteer.
Right.
They weren't, it's easy to say, I'm going to go pick up trash on the highway, but maybe that's not their thing,
Right.
and it's like partnering them with things they really enjoy maybe doing and helping and making them feel like that they're making a difference. And so I would like just curious about you guys, that volunteer program, part of what y'all do. And am I correct in saying like a certain portion of the hours is volunteerism, or is that not a thing anymore?
Yeah, it's still a thing, but CMS has changed the rules on it. Used to years ago, people could, quilt some, make quilts at home on their own time and bring them to the hospice company and say, these are for your patients. And that used to count. Or if they would come into the office and help us put gift bags together for the patients, that used to count. They have changed it to where it has to be in person with the patient. So Amy Finley, our other social worker, she's our volunteer coordinator. And so she's the one who will call our volunteers and say, hey, we have a patient that's needing this, that, or the other. Can you help with that? So it has to be directly I don't know if I'm going to say it right, directly assist a patient. So whether it's going and mowing their yard because they're now no longer physically capable of doing it, that time would count. Or just going and sitting with someone, reading them the newspaper, that would count. If we were to go and do a program at a nursing home, it would count if our patients are present at the event. So they have changed it to where it's a little harder for volunteers to assist hospice. But I think they're just wanting it to be more meaningful more direct and more one-on-one. So it is a little different. It does make things a little bit more difficult just because of everything that's been happening the last few years, especially at facilities where you can't, and not just anybody can come in. Yeah. So that's been a little bit challenging. But yes, as of, and actually in the last couple of years, they just halted volunteer program because they were having a hard time. Facilities have their own rules that they have to follow.
Right. Which you guys have a lot of provider to provider.
Yes.
So a lot of, and people, yes, you guys can be in their home. Yes. But also in a nursing home.
Yes.
Or an assisted living.
Wherever
you guys
the patient calls home, we go to them. So it could be a private residence, a nursing home, assisted living. It could be at a motel. I mean, we meet patients where they are, wherever they call home. And then,
so you're going by their rules as well.
We go by yes. So each facility is different. Each facility has their own, guidelines a lot of the time as to what they have to follow. So we are a guest in their facility. So yes, we have to follow their rules. But CMS has changed it to where I believe as of, May 1st, everything goes back to normal with volunteer work. So I do know that we've had, just over the weekend, at the Farm and Home Expo, we had 2 people come to us say, hey, we'd love to help. So, and then how that works, on our side is we usually schedule a day of training. It's a good 6 to 8 hours worth of training because we want you to learn about hospice. So we teach you about hospice in general. We teach you
death
all
is
the
a very
roles.
touchy subject.
It is. It's very hard. And that's why we've created our planning ahead guides. And they're free to the public that you can come by the office and pick them up. But it does start that conversation. It's a very difficult conversation to have. But the more you talk about, hey, what do you want done at your funeral? Do you want to be cremated? Do you want to have, a burial? What music do you want played? Is that important to you? The more you can talk about it and make it, less taboo and less scary, the better off you're going to be in that high tense situation once that loved one passes. It's going to be hard no matter what. But if you can at least have some of those questions answered and written down and put away somewhere that you can go to when you're in the middle of that emotional state, having something written down just makes it so much easier on everybody involved.
I know another thing that you've kind of started and you head up, and I would just like you to tell us about that, and that's the Alzheimer's support group.
Okay.
And just hear kind of what you've got going on with that. And
oh goodness,
it seems like it's pretty busy, and I want to give you a lot of praise for that, because I know how hard things like that are to get started and to get involvement and just because a lot of times you feel like you start something and then you see the benefit of it, but you have a hard time getting people involved.
Right.
In community involvement, which if you don't have community involvement, then you don't have anything.
Right.
So I'd like to hear about what you got going on with that. And
we're very fortunate to have such a wonderful community that we do here in Elk City and in Western Oklahoma in general. Back in 2018, I was asked to be a part of this group that wanted to bring awareness to Alzheimer's dementia to Western Oklahoma. I went to this meeting. There were a lot of people from a lot of different a lot of different healthcare communities, whether it was the hospital, assisted living, nursing homes, people just in the general public who maybe have been affected by Alzheimer's one way or another. We just thought, hey, let's just get a walk together. Let's just see what we can do, raise some awareness and funds for the Alzheimer's Association. So we did. We had a walk. We were in contact with the Alzheimer's Association. We were a part of the Longest Day fundraiser. So the Longest Day fundraiser is held in June on the summer solstice, the longest day of the year. And it just represents how every day is the longest day for someone who is fighting Alzheimer's or for caregivers. So we had our first walk in 2018 at the walking track at Ackley Park. We had probably 200 people show, and it was wonderful. We had a great time. It was so hot. There was no shade, but we made it work, and we just had a great time. And so then we decided, hey, that was so much fun. Let's do it again. So 2019, we did it again. And then, in 2020, we decided to become an official nonprofit. I think in that short time, we had come across so many people just in our own community that have been affected by Alzheimer's, whether it was themselves who have been diagnosed with it, whether it was their family members, their loved ones, or for a lot of us who work in different facilities, working in hospice. Alzheimer's is an end-stage disease, so we work with it a lot at facilities. So we just said, hey, let's just keep this going and see what we can do. So we created the nonprofit in 2020, and what our nonprofit looks like is yes, we want to continue to bring awareness and education to Alzheimer's dementia to the community. We wanted to get the in-person support group back up and going because of COVID and everything. You couldn't do anything in person. So Christy Shervinka, she is our support group leader. They meet the second Tuesday of every month at Assembly of God Church, I believe from 6 to 7. We wanted to provide financial assistance to those in need. So what that looks like is, how do I say this? So with hospice, this is one of the things. With hospice, a part of the hospice program is called respite care. Mm-hmm. That is, it's provided service. And what respite care looks like is, say you are taking care of your loved one at home. As a caregiver, it is a 24-hour job. It's hard. It's very emotionally draining. Sometimes things come up in your life that you have to take care of, whether it's taking care of
vacation too.
Yeah, taking care of yourself, going on vacation. You need a break as well. And sometimes other situations happen, work happens. So respite care is a service that you can go into a facility that has 24-hour caregivers that we contract with up to 5 nights. So it's either 1 night of assistance up to 5 nights of assistance. So that is provided by hospice. It's a part of that hospice plan. For those who are caregivers of a loved one at home who may not need hospice yet, but you still need a break, what do you do? Maybe you've exhausted your neighbors' support, your church's support. You don't have anybody, any other close family that can come and help you, but you just need a couple of nights of assistance. So what we wanted to do with the Alzheimer's Collaborative was be able to have funds available that could help the caregiver take care of their loved one however they see fit. So sometimes it might be bringing in a caregiver, for 4 hours or 8 hours just so they can leave and have a little break, to where we could bring, get it above all home care involved and help pay someone to come in and help them. Or if they were needing to go away and they needed to, have their loved one go to a facility for a couple of nights, then if we have the funds available, then we can try to help cover that cost. A few years ago, we were able to provide those robotic memory pets. Have you seen those? So they're robotic cats and dogs and we were able to donate those to a lot of the memory care units in our area, just as a helpful tool for them to use. So we want to use our funds that we raise, however it looks. We wanted to keep it very open and very fluid as to. And as a social worker, my job is to, what are the things that you're needing? What resources do you already have available? And then what can we do to fill the gap? So that's kind of what we're trying to do with our funds with the Alzheimer's Collaborative is what can we do to fill the gap so that you can continue to help your loved one and take care of yourself as well in the process.
Yeah, that's great. So I mean, when I hear the story about how you got that going and just basically, the involvement, it's pretty phenomenal.
It
because
is.
I've been involved in all kinds of things, whether you're talking about all that, I've been involved in that. I've been involved in Relay for Life, for example, and just tons of different things. And the involvement is really always the struggle, trying to get people involved. And yet when I see what you have going on with that, I see that you've got the involvement and you've got the support and the way that you were able to put that together is pretty amazing.
Thank you.
Good job on that.
Thank you. Yeah, I mean, really 2020 was a hard year for everybody. And how do you raise money for a cause when people are already struggling and just trying to figure out what's going on in the world? So even in 2020, we still raised $6,000 for the cause. And I think how we were able to do that is, yes, our connections in the community. We created the slogan, Shop Local, Share Awareness, because it was really important to us to support our community who is supporting us. And we wanted people to continue to go in and shop the mom and pop places around town, shop local, keep everything as local as possible, who were struggling during that time. And I think we have kept that momentum going. So we have our event planned for this year. Actually, it's always the third week of June is Paint the Town Purple Week. So you'll see the big big banners everywhere. And this year, our big event, we're still going to be partnering with all of the community, people who have been with us for the last few years. But our event that we're going to be putting on will be Saturday, June 24th at the Arrowhead Center. We have rented out the entire building. We're going to have all kinds of events going on all day long. So there's something for everybody, something fun to do to get out of the heat. It's air conditioned, if you don't know. We're planning to do a walk-a-thon all day long. We're going to have a paint party. We're going to have a Zumba class. We're going to have bunko. We're going to have, I think, a charcuterie board class on how to put those together. So something, a cornhole tournament. We're going to have something for everybody. So we want everyone to come out, support the cause, have some fun this summer, and just have a good time and still raise money. We still raise money for the Alzheimer's Association, but we also try to keep those funds local. Another thing that we started last year was a scholarship. So last year we gave out our very first scholarship at the Brown and White Assembly for $500. And what that scholarship looks like is anyone can apply as long as you're going into a helping profession. That was our only the only thing that we had really wanted to look at, because so many of us who came into the Alzheimer's Collaborative, we have different backgrounds, we do different things, but we all want to help. So it could be medical, it could be social services, it could be ministry, it could be anything. But what type of helping profession are you wanting to go into, and tell us why that's important to you? So last year we gave out our first $500 scholarship. This year, we were given a wonderful donation, and this year we're giving out two $500 scholarships. We're going to be giving one to at the Brown and White Assembly at Elk City, and we've added Canute. So the senior class over at Canute, they've been given the same parameters, and we will be we'll be choosing a recipient for that scholarship there in Canute. Our goal is to hit, to have enough funds that we can give out scholarships to all of the schools in the 60-mile radius that we serve.
Wow. I think that's great.
Thanks.
So I want to pick your brain. And by the way, I think, I think that everybody wants, every company, every organization wants somebody who is able to do what you've been able to do. And I mean, so honestly, a great job. Like I can see the benefit in what you're doing, and it has a lot of involvement. And I think that's the key to anything you're doing. It's like, you've got to get people that are passionate about it. You got to get people involved. You got to get it's really collaborating, because in your case, it's not just people that work for it has nothing to do with your company. You know what I'm saying? It's getting people involved that are from different organizations and getting them to collaborate. And so good job. I do want to pivot away from like work a little bit. Okay. And, I'm very curious about, a lot of the topics and stuff we talk about on this podcast is definitely a lot of mental health stuff, suicide awareness and suicide education. And that's, we just started a not-for-profit recently, and we had our first board meeting yesterday. And that's definitely a platform that I'm very concerned about, and I talk about a lot. But, I have a friend that's a social worker. Her and we worked together for, 5 years or something, several years. And then, we're still friends. And she, and the reason she's actually on our board, and, I had her on the podcast. This is a beginning podcast, probably the first 5. But one of the things we realized through, just as we were talking on the podcast, that between her and I, we had witnessed or been a part of about 500 people dying. And during that time period that we had worked, and during our careers, I'll put it that way. And what I mean by that is that we were taking care of this person and they passed away, or this person. And really it was kind of amazing to sit there and realize that the number of deaths that we have been a part of, the number, and people that we really loved and care about. And I think if you're from the outside, you say, well, yeah, they were old or whatever, but that had a pretty profound impact on me, because when I backed up, and if you had a few years ago, I would have said something like, I wouldn't have said this in public, but I would have been like, in my mind, I thought I was pretty numb to death, meaning that I've seen it. I understand it. I've been a part of it. But then also when I had deaths that were close to me, then I started realizing I grieved a lot more than I thought I would grieve, as an example. And so so it really started something in my mind that is really a tragic event. If you think people in war and how many times they've seen people die and those kind of things. So I'm curious, and this is again more personal, like how do you think that, like, number one, how you deal with being around, end of life as much as you are around it, how you deal with that personally, and any advice that you have for maybe somebody going through the grieving process of like somebody close to them, but how your advice to them on that and how to deal with it. Maybe even a healthcare worker who is my daughters are in nursing school at SWASU. I have twins. And they're fixing to graduate, but they're doing a lot of clinicals. And I'm already amazed by how many times they've had to perform CPR on somebody.
It's traumatic.
It's pretty crazy.
Yeah.
Like I was talking to my daughter last night, and I want to say it's like been 3 or 4 or 5 times. And what people don't realize, I didn't know this, that if somebody comes into the hospital and you're performing CPR, they always go to the student to do that, and so they can learn. But you think about it, a brand new nurse doing CPR, dealing with death right from the beginning, and then you take years of that, and that's part of the training we have to provide, like staff. Whenever you're talking about through your organization or through a nursing home, you have to provide like how to, kind of this, like how to deal with that and how to deal with death, how to deal with, So I just like to hear your thoughts on that. And how you might.
I think when you're in this profession, you learn to compartmentalize. And I think even as a social work student, because not only is healthcare traumatic, but if a social worker going into child welfare, there are situations that can be very traumatic. And we've always been taught not to bring our work home. So it's learning how to compartmentalize and leave work stuff at work and home stuff at home. But sometimes that gets a little muddy, especially when you work in a small community and your home life and your work life kind of coexist with each other in a very profound way. I am a huge advocate of counseling.
Yeah, I agree.
I feel like even if in a work setting you set time in your we have Monday morning meetings. Every week we discuss, what happened over the weekend, what's going on. I think it's very important to give your team the opportunity to talk about how they're feeling and talk about that relationship that they had with that person, kind of in a group counseling session. But I think letting it be a safe place to talk about your feelings, to talk about what's going on, and letting people have that outlet, I think is very important. Because I feel the more you keep something inside, the more it's going to eat at you, no matter what the situation is. I think saying things out loud, as difficult as they can be, is very therapeutic. It does make the situation real, which it makes people very vulnerable. But the more you can say it out loud or talk about it to a safe person that isn't going to condemn you for your thoughts or your feelings, I think is very important.
Yeah.
I think my first experience with loss, yes, as a kid, I had, aunts and uncles or distant family people pass away. I've been going to funerals since I was 4. And going to Catholic funerals since I was 4. So it's a long situation. And so that was never a hard thing for me. But I think my very first experience with a close loss, I had just turned 19, and I had a friend here in town who died tragically, and that was so hard. And it took me a long time to just get through those feelings and those thoughts of how that situation happened. And we all experienced that, I think, at one point in our life or another. And then
if you haven't, you will.
If you haven't, you will. Mm-hmm. And I think just finding a safe place to feel vulnerable is very important. Whether it's talking to a counselor yourself, whether it's finding a support group, Grief Share. There is a Grief Share. I'm a part of that too. Grief Share support group here in Elk City. Rose Trotter is in charge of that. It's a 13-week program, and it's for anybody who's experienced loss. I think that's important, or in a work setting where you can, especially in nursing homes, assisted livings, if you can designate a time for everyone to have their own little memorial at the facility for the staff, or if we as social workers and chaplains can come into the facility and even lead it and say, hey, I don't really know you personally. I don't know the situation, but this is a safe place for you to cry and to be angry and to go through all of those feelings to where you feel a little bit more comfortable inside your skin, where you can, take off the mask, be vulnerable, put that back on, and then go help somebody else in need. I think just being able to find someone safe and be able to talk about it openly.
Yeah, I agree. Very good. I appreciate your advice. I have tons of respect for you. I'm here if you ever need. I always tell you that, but it's true. If I can ever do anything in the stuff you're working on, I want to be of assistance. How do people reach out? Definitely website or any information that they can give to get in touch with you guys. And then also you personally, if they want to maybe Facebook or however, what's the best way for people to connect with you?
I give everybody my cell phone number. I don't care who has it. Yeah. The Western Oklahoma Alzheimer's Collaborative does have a website. It's www.woac-ec.org.
Okay.
Yes. You can email me at jwestern@ch-hospice.com.
Okay.
Or you can call me or text me at 580-339-2984.
Great. Well, you guys, if you ever need, I know Julie well enough to know that if you ever have just questions, you want to know some more information, you just need some help with a certain situation when it comes to maybe a loved one or yourself, then she'd be happy to help you. So give her a call.
I love a good challenge.
Yeah, that'd be good. Well, thank you so much.
Thank you.
Hope you have a great day. Thank you, guys.
Thank you for listening to Positively Undefeated. If there was something in this show that resonated with you, please share the show with your community. If you want this show delivered each Monday morning to your podcast app of choice, please subscribe or follow. And if you'd like to get a hold of Burl, please do so by going to burlstricker.com/contact.